we're going to see the alarm symptoms and signs of cephalea, of secondary cephalea. So this is when we're going to do a orient imaging of the brain when the patient presents with cephalea plus these symptoms or signs. It is the first cephalea of the life, especially if it is the worst headache or worst pain of the life. In that case, the worst headache of the life, that phrase is the classical presentation of a subarachnoid hemorrhage due to a rupture of a berry aneurysm or saccular aneurysm, the same thing. So first versus recurrent. If there is a sudden onset of the headache associated with systemic symptoms, this will include fever, moderate weight loss, fatigue, etc. Associated with a known underlying disease like AIDS or cancer, changes on the cephalea characteristics. It could be on the intensity, severity, frequency, etc. Or if the head is now constant and there is no interval free of cephalea. Or changes on the exploration, physical exploration. This could be cognitive functions or asymmetry on the exploration of the face or of the extremities, because could be a cerebrovascular event. So and also if there is a increase, let's say, in the cephalea, severity of the cephalea, when the patient is doing, let's say, Valsalva maneuver, like lifting an object or coughing, sneezing, something like that. Or if the cephalea wakes up the patient or occur at the morning, these are signs of intracranial increased intracranial pressure that could be seen, for example, on pseudotumor cerebri or in a tumor that is causing this increase in the intracranial pressure. So we have unilateral versus recurrent, sudden onset, associated systemic symptoms, underlying disease like HIV or cancer. Changes in the characteristics could be frequency, intensity, or the periods of free interval. The asymmetry on exploration, physical exploration, or cognitive function, or associated with the increase in intracranial pressure that will be manifested as worsening cephalea with lifting objects or coughing, that is with increase the increase in intracranial pressure that will be seen after Valsalva maneuvers, or occurring at the best time waking up the patient or at the time of wake up.